Okay, fine. Okay, thank you. So today in the afternoon we shall discuss very briefly health related to the disaster. Okay, that is during disaster or before or after. So what would be the scenario of the health condition like that we shall discuss. So we know that mainly our health is going to be determined by the environment we live in. Okay, so it may be an economic environment or a social environment or a physical environment or a cultural environment. Any changes, any interventions, any disruptions in these aspects will also going to affect the health of an individual. So health effects or changes in health resulting from exposure to a particular source. Now, what is the meaning of the term health problem? It means that a disease, health problem means it is a disease or a medical ailment or an condition that poses the risk of diseases or medical ailment is generally referred to as a health problem. In the sense, if at all any, what we can say, an upset in the the health of an individual, in his environment, we call it as the health problem. It may be due to a disease, it may be due to an injury, it may be due to any psychological upsets, so something like that. So that is what we call it as the health problem. Now, in a disaster, we know that whenever there is a disaster, generally either there will be the deaths or there will be the physical injuries. In addition to that, we also see people will lose their property, their home, their kith and kin, so they may lose their community. So these things are going to be a normal impact or effect that we are going to see during the disasters. So when such things happen, so people will be to the maximum, we can say, experience, or they are going under stress condition. They experience stress or they will be under stress conditions. Now, so such stressors will be there in even sometimes, even before disaster or during disaster or even after disaster. But any such stress condition in an individual will always lead to the health problems. So it may be even due to emotions. It may be on a positive side or a negative side. Emotions also may lead to the stress. So the stress reactions appear to be very common after any type of disaster. Now, what are the qualities of a good health? So, if one has to be very fit, one wants to be healthy, so his behavior, right, should be very normal. His lifestyle should be normal. That means he should have a good sleep. He should have a normal, healthy diet. And generally, an individual who is going to be healthy will be very active. Maintaining a normal body weight according to his height, according to his age, right? So those things. And one should not smoke, or if at all they are alcoholic, they should have a limitation in consumption of alcohol. So if all these things are there, then one can have a good health. So the quality of a good health is the one wherein it mainly depends upon your lifestyle behaviors. It mainly depends upon your lifestyle behavior. And in addition to that, you should also have a good healthy diet. Good healthy diet with cleaner habits. Then they are the qualities of a good health. Now, during disaster or after disaster, generally, what are the health implications of disaster? Prior to disaster, you may ask me, what is the type of health problems that we may come across like that? No, actually, prior to disaster, sometimes they will forecast at what places there may be possibly the occurrence or incidence of cyclones or tsunamis or earthquakes, like that. When they forecast it, how the people are going to be prepared, how the people are going to be mentally ready to face such type of situations. What would be there, what we can say, the thinking. And if it were to be in a short span of time, whether they will be under stress, whether that stress may lead to them to any sort of either physical health problems or mental health problems or something like that in a community. Now we shall see in general what are the health implications of disaster. So very broadly, the health implications of disasters are going to be categorized into two kinds, that is direct health consequences and indirect health consequences. The direct health consequences include generally the injuries and the death of the people or the animals. So there will be the loss of life of the people or the animals, and also there may be the injuries. They are going to be the referred to as the direct health consequences. The indirect health consequences are nothing but those happenings or those events that occur after the disaster has taken place. That means, suppose say there is an earthquake. When an earthquake is going to take place, or a volcano or cyclone or something is going to take place, after that, so what would be its impact on the environment? And in that environment, the people or the living entities who are living, how they are going to be affected. So that means directly they are not going to be affected, indirectly they are going to be affected. Suppose when there is earthquake, assume that there is an earthquake. So a lot of dust and other particles are going to be given out. And if these dust particles and other things are going to pollute the environment, including the water body, so the water body gets contaminated. And if the water body is going to be contaminated with various such type of dust and other things, right? All unwanted things and everything, there is a chance that it may even support the growth of certain vectors which may cause the communicable diseases. A food may be what? Damaged, or a food may be contaminated, or a sewage water may get contaminated with a fresh water body. So likewise, and sometimes whenever there is an eventuality like an earthquake or a tsunami, people will get crowded. So the overcrowding to protect themselves may also lead to certain health problems. So likewise, any such happenings that is going to take place after a disaster, and which in turn is going to cause the health hazards among the individuals, is called indirect health consequences. It is referred to as indirect health consequences. Now, there are certain public health challenges, sometimes in an emergency. Okay. Now, that means whenever there is suddenly, all of a sudden, there is any casualty, any disaster that is going to take place. So, the public or the people who are going to be affected, and generally, when the entire community is going to be affected, okay. So, an emergency setting will be made. An emergency setting will be made to cope up with managing or mitigating the impacts of this disaster. So, during such disasters, generally what happens? The resources and infrastructure are destroyed, and there will be the communication. So, communication, say for example, when a disaster takes place, say suppose flooding takes place, people will be in the remote area and suddenly flooding takes place. So how to shift the people? They want to communicate it. So because of flooding, so you may not be having a proper communication. Suppose there is a cyclone, there is a high wind velocity. So the electricity, the satellite link, everything may get disrupted. So you cannot communicate it. So thus, these are the challenges that one is going to meet with. Though we knew that disaster has taken place at a particular place, but how to rescue the people, how to reach them, and what are the things that are happening. So even they can't communicate it. Just once it has taken place, immediately we may come to know about it. But later on, after the disaster has taken place, there is post effect, post activities, or post what we can say the health challenges after disaster that one should look in. So during such cases, so suppose the individuals are going to be affected to a greater extent. Entire population is going to be affected. How to treat them, how to carry them, how to, what we can say, make arrangements for them. So all these things, populations are going to be massively affected. It includes even the health personnel. Even it may be a doctor, even it may be a nurse or any staff that is associated with taking care of health. Because we do not know what is the exact place where the disaster may take place, right? So you can't exactly predict the exact location and exact place or to the area to what extent the disaster may be spreading. For example, when tsunami has taken place, nobody has expected that for how long it will get into the interior of the coastal areas of the country. So it has washed out the buildings, health centers, persons, everyone. So that is why whenever the health challenges will arise during such disasters, even the people who are going to be affected may also include the doctors, nurses, and people who are associated with taking care of the health of the community. So that also may get injured. That also may get infected. So all these are all the challenges. Then what do you mean by the public health? When I say the public health, it is nothing but the science and practice of protecting and improving the health of a community. So, large number of individuals, when they are colonizing or inhabiting a particular area, and in that area, how to protect and how to improve the health of the individuals by preventive medicine or through health education or by controlling the communicable diseases. So, what are all the sanitary measures that should be adopted? So, monitoring of all the environmental hazards. So, with all these things are included or going to be studied in the public health. So, that is why public health is defined as the science and practice of protecting and improving the health of a community. Okay. Now, the health implications of disasters. So, direct impacts. What will happen when these disasters take place? So, there may be a high mortality, the death rate may be increasing. All right, all of a sudden you can see a good mortality may be there. So it is not good actually, it's bad, but a greater extent of mortality can be seen. Injuries may be there for the individuals. A physical trauma or injuries uh, uh, that may require an immediate attention and assistance from the treating personnel, health personnel, so is required. So, whenever disaster takes place, there are many people who are going to lose their houses. They are going to lose their sheltering places. They become homeless. So, they will be greatly affected. So, they need food, they need water, they need shelter, they need basic sanitation. See, all these will be the direct impact of the disasters. And when such things happen, what will happen? Automatically, communicable diseases will start. See, whenever any disease, say for example, mosquitoes will be on the rise. So assume that mosquitoes will be there. The population will be increasing. And if the community people are there, and if these vectors are going to carry by the individual, because they do not have sanitation, they will not be having shelter. So they will be in any place. It may be an open place, it may be a dungeon place. We do not know. So for the survival, they occupy some place, some habitat. So in such cases, so there may be a chance that there may be a communicable disease. There may be an acute illness. There may be the illness which may be chronic. And whenever disaster takes place at a particular place, never be under the impression that all the people in that area will be healthy prior to disaster. There may be people who are healthy, there may be people who are suffering, there may be aged people, the people may be vulnerable for certain diseases. So all of them are going to be affected. So just imagine when such things happen all of a sudden. So what would be their feelings? So what do they feel? There will be a mental trauma. So psychological effects will be there. And availability of food and nutrition. So many people sometimes many people will be purchasing their day-to-day food and food related materials every day. But if a disaster has taken place where you cannot go out and there will be no shops, there will be no markets and nothing will be there, and even your own homes also may have got destroyed. So in such conditions, the direct impact will be the what? Energetic sources for the survival, nothing but food and nutrition. Now, many environmental health problems may also arise. So, that's how we can see the health implications of disaster. If at all one has to take care of health also, there will be a lot of problem, and prior preparation for any area whenever a disaster is going to be is going to likely to occur, so is a must. But in spite of these things, in spite of pre-preparedness for mitigating or taking measures to meet the challenge of disasters, we should reach the spot also. One should reach the spot, and to reach the spot we do not know what type of problems that have arisen, whether it is only the, if it is only the health related, if it is only food related, immediately one could have what sent all the things. So there will be a manifold problems whenever the disasters take place. So the public health, so vulnerability, physical, social, economic, environmental, institutional vulnerability will be there for the individual. And this vulnerability does not, that is, what is vulnerability? If I say vulnerability is the inability to resist a hazard or respond when a disaster has occurred. So when you cannot resist, when you cannot respond in a positive way to overcome that effect, then automatically you are supposed to be in a vulnerable condition. That is, your inability to resist or to mitigate or manage with such type of hazards is called vulnerability. And to what extent you can see this vulnerability? This vulnerability may be for the entire community or for the entire services in that community. So all these things may get disrupted or damaged when a disaster is going to take place. So in other words, this vulnerability is nothing but the propensity of the things to be damaged by a hazard. So it makes you to be very much weakened. That is what we call it as the vulnerability. And this vulnerability, how it weakens? It may be in your physical body or physical environment or social environment or environmental or economic. So in all possible ways, so it will is going to make you to be vulnerable. It weakens in so the propensity means in Kannada we call it as durbala, durbalagoliಸುವುದು. So it propels the entire community or the population in various dimensions, in various factors. So thus the human population may become vulnerable at the region of disasters. And the scale of vulnerability, it once again, it varies from human to human, household to household, community to community, country to country. So they are all very site specific. So where exactly these disaster have taken place, and what are the say at what time it has taken place, and for how long it is going to be prevailing. So, and it may keep on changing also. Today, whatever the way the vulnerable condition is there, tomorrow it may change. So that is why we say vulnerability is also dynamic. So vulnerability is the propensity of the things to be damaged by a hazard. Now, what are the risk factors that are there for these vulnerable populations? So they may have more intense needs before, during, and after disaster, which include the need before or during or after by the children. See, they may see, for example, for the children, they need, if there are many childs and child and infants, if at all were to be there, they need milk. So if the supply of the milk is not there, see, look at their need is the drinking milk, because they take only milk as their food. They can't eat rice. They are the infants. Look at that, either before or during or after disaster, what is the risk that will be there with respect to it? It involves all people with all ages, and the elderly people are also going to be much more prone for many of the health hazards. So that means they are very weak. They are not that much mentally strong. So they are almost strength has come down. They are frail elders. So such type of people will be there. And sometimes, irrespective of age, though even sometimes among the youngsters, we are seeing that the people become mentally nervous, right? So when such disasters have taken place, and there may be people with physical disabilities, how to carry them when such disaster have taken place? If you are a healthy and strong individual, you may run, you may escape, you may start moving fast. But what about the people who are having the physical disabilities in such areas? How to protect them? How to carry them to a safer place? So likewise, there are many risk factors, and sometimes people are dependent. Substance dependency will be there. So they knew it is flooding, the water is gushing, they should escape for their life, but they are having an attachment towards their property or materials. How to live with? Oh, I have kept a bag full of cash. I have kept a bag full of jewelry. So let me take like that. So by the time they are going to take all these things, make an attempt to carry them. So the flooding may take place to a severe extent that even they themselves may not be able to survive. So thus, these are all some of the risk factors that will be associated whenever the disasters take place. And people living in poverty, they will not be having anything to manage to overcome these things. So there are certain health concerns. The main problems related to the health are the water problem, because even though there are plenty of water during flooding, but you cannot drink all the water because it is getting contaminated with many things, right? It is highly polluted. So there will be no proper, what we can say, hygienic condition in the environment. So sanitation will be a problem, and there may be vector-borne conditions may also be there. So all these things are going to be resulted. So to get fresh water, it will be a greater task. So, and in such areas, there you cannot supply the water. So to bring in fresh water, if there is a larger number of individuals who have been affected in the disaster area, to see that immediately everyone should be given the clean water, it may not be possible immediately. But see, look at whenever a disaster has taken place, people will be under a lot of stress, anxiety, fear, right? And they will be always thinking whether I can survive or not. So, whether my community is there, where my community, because people may even get scattered here and there. They run away here and there to escape from the various types of disasters. So, thus, it all leads to inadequate, what we can say, hygiene, sanitation. So all these things, sanitation means it includes all your day-to-day natural calls, everything. So such type of problems may also arise. So there may be an increased incidence of diarrhea, dysentery, respiratory infection, and other communicable diseases. Suppose when there is a high wind velocity, cyclone, etc., the dust particles that are going to be given out in the environment, even you cannot inhale. If you inhale, so many dust particulate matters get into your respiratory tract. You may feel difficulty in respiring. So medically, actually, whenever you are going to face respiratory problem due to the inhalation of the particulate matter, so the lungs or the windpipe or the tracheal tube, they are the one which are going to be greatly affected. Any such effect, part that is going to be affected in the respiratory tract, and when you feel difficulty in breathing, so medically it is referred to as pneumoconiosis. Pneumoconiosis, they use the word PNEU, MO, NO. pneumoconiosis. That is the one that is going to be resulted. So that means various types of respiratory related problems may arise, and even allergy also may be started. So we do not know what type of water or what type of particulate matter or what type of material for which you have been exposed. So all these things may lead to even the various health hazards. So communicable disease means the one which is going to spread from individual to individual. Say when a disaster has taken place, in en mass you are going to move from one area to another area, and you want to escape from that area for your survival, and you do not assess at the time who is a healthy person, who is an unhealthy person, who is having a disease, who is not having a disease. So there is a chance that communicable diseases may spread, and you may drink whatever the water that is available. So if you are thirsty, so you may drink whatever the water that is available in your vicinity. So that may also be what? Contaminated. It may be contaminated with the fecal matter. When it is contaminated with fecal matter, so fecal matter loving bacteria will be on the high scale. So they may cause various diseases. So likewise, there are many such type of what? Public health concerns will be there. When long-term exposure to polluted air has been there, so individuals may get depression or they may get schizophrenia. That means they are not going to be what we can say stable in their behavior. Even though if something is not happening, they may feel that, oh, something is happening. To that extent, they get upset. So such type of diseases may be resulted like depression, schizophrenia, etc. The impact of this air quality on mental health is such that so always it is going to affect. So if air quality is not good, air quality is not good. When you inhale, when you feel difficulty in breathing, okay, or if you get any allergic reactions on your body. So added to that, if it is spreading to the entire population of that area, so you will be experiencing that you are not physically fit and you are not mentally all right. So all these things are going to be resulted. Now, to give you the simplest way of communicating this is that now if you at all you are going to make a livelihood in the Gangotri campus area, in the university campus area, some of the air quality is good. You will be having a perfect mental health without any, what we can say, the pollution or something related aspects in that area. And there will be no too much of what we can say, the busy noises of people or transport or anything else like that within the campus. And you are living only in this area over a period of time. And all of a sudden, if you are going to be taken and put it into a majestic area of the Bangalore city, so within few hours, you start feeling headache and giddiness. And the reason is being, so that's how the air quality play an important role in the psychological or you can say the mental health of an individual. Now, this is because the air pollutants that is going to be resulted due to a disaster, including the particulate matter, they may induce inflammation and oxidative stress in the brain. So when the inflammation and an oxidative stress, it is a scientific phenomenon, so takes place in the brain, it may lead to the depression. So the manifestation of depression is mainly because of the air pollutants. Now, what are the factors that are going to be affecting the human health when such pollutants arise out of the, what we can say, disaster? Nature of the pollutant, what type of pollutant for which you have been exposed, concentration of pollutants, for how much of pollutants you have been exposed, and for how long you have been exposed. That is called the duration of exposure. And before getting exposed, what was your prior health condition, and when you exposed, what is your health condition. After a period of time, what would be your health condition? That means you are the receiver, you are the recipient. So what would be your state of health when such type of pollutants are going to be on the rise in your environment? And what is the age group of the receptor? Whether it is a small infant, whether it is an adult or a teen, or it is middle-aged or very old age. So because different individuals will be having different immune power, right? That's one thing. And also they will be having, even psychologically, they will be having different ways of or different strength of the resistance to any of those hazards. So thus the factors that mainly affect the human health during disaster is to what type of pollutants, to concentration of pollutants, duration of exposure, all these things are going to be instrumental in determining the health of an individual. We know that mental health is a state of mental well-being. That is, for any sort of stresses of life, so your mental state, mental health should be well to manage with it for any stresses of life. So that means you should know how your ability to cope up with such stresses of life. So if you can cope up with any such stresses of life, then you will be mentally having a sound health. Otherwise, it will not be. It's the same thing goes for the entire community. Say if some dangers are there during disaster, so if every individual becomes panic, or if every individual is having the strength, and if one individual becomes panic, so it may be communicated to the other individuals in the community. So that is why one should try to look into their mental health. But as we speak, it is not that much easy when a disaster has taken place. All of a sudden, in an area, if flooding takes place or an uncontrollable high wind velocities of cyclone or tsunami takes place, what can we do? There will be no chance for us to even think of where to go, how to do, where to manage, how to manage anything related to. So you will primarily you will be struggling for your own life. You do not bother about your kith and kin also at that time. To that extent, you will be upset. So the main problems during disaster that is associated, even based on various studies wherever the disasters have taken place, and as we have seen, as we have heard, as we have read, as we have experienced. So what are the various health problems? So epidemics, that is communicable diseases, will be on the rise. For example, diarrhea problem, typhoid, dysentery, right? So various type of hepatitis, kinds of hepatitis. So all these types of diseases, acute respiratory infections, ARI. So these things are greatly associated because you live in a group, you live in crowd. So that when you are in a group or a crowd in a particular or a limited area, the chances of spreading of the diseases will be more. So this is a major challenge, even how to manage the public health under such circumstances. And also, like vector-borne diseases, malaria, dengue. So you cannot suppose you are going to be placed in a shed or in a tent. So how to control the vectors like mosquitoes and other things, and how to prevent this malaria or vector-borne diseases or dengue. So it is not that easy as we think. So these are all the challenges that we can see related to the health. Tetanus is going to be maybe resulted, typhus may be resulted. So there are different kinds of what we can say the diseases. What we can say, different type of cough and other things. Typhus is different from typhoid. Never be confused. Typhus is a different disease, typhoid is different. So this typhus, it is going to, you are going to have a fever, and it makes you very much, what we can say, a weaker and weaker individual. So sometimes we have also seen incidents of dog bites because they are also scared. So when they are scared of any of these disasters, so whomever they come across, they start biting them. And we know that through dog bites, rabies may be what? Spread. And fever may be continuously relapsing. So all these things are going to be the main health problems during disaster. And actually, mass immunization is the immediate requirement during such type of things. But as I told you, once again, it is the place where it has taken place and how to reach that place and how many people are there, how much of individuals are there, to assess each and everything and then to supply and see that though technology and science has been advanced, in spite of that, to by the time we reach to the spot and to start initiating, taking care of measures to mitigate all these effects. So at least to some extent, definitely we are going to be seeing the loss of human life or damages to the health of the individuals can be seen. And for how long the individuals are going to be kept in an area till everything comes to normalcy, they will be placed somewhere else. And by that time, so there may be a chances of once again the epidemics like tuberculosis, measles, etc. may be there. And we know that whenever that disaster has taken place, so mainly food problems will arise. So there may be shortage of food, right? And food may be stuck elsewhere. And even if you send the food, the distribution problem of the food will be there. And safety and the suitability of the availability and preservation of the food is also another challenging task. Because whenever an individual is not having sufficient food, he will not be having energy, right? When he doesn't have energy, so it's quite but natural for him to be upset. So he may behave indifferently. So some people, to overcome that fear or shock, or for having lost somebody, see, in a family, suppose somebody loses their own kith and kin or something else like that, from the shock, if they could not come out, they may become addict there itself, and they may become alcoholic. And if it is severe weather, some will start smoking continuously. So all these are all the problems associated with the social reactions. Okay. And immunization, right? So whom to immune, how to immune, that will become another problem. And how to control the vectors, as I said, the spread of mosquitoes and other things. All right. How to say that the contamination of these sewage, and how to see that the sewage disposal should be done in that area, and how to increase the accessibility of fresh water or healthy water. And even remember, when disasters have taken place, many people will die. So when these people die and their bodies start decaying, once again you will experience the change, I mean the danger of the disease transmission, disease occurrence, disease spreading. And how to carry these dead bodies? So then once again, whether you are having gloves or not, whether you are having disinfectant equipment or not, so all these things will be the main problems associated with the management of the disasters with respect to the health. Now, indirect effect also may be seen due to disasters. So primary healthcare facilities might have been lost in that area, right? Normal living conditions might have been lost. So all these things, that food and nutrition may be available, whatever that is available may not satisfy the entire population. It may not cater to meet the requirements of the entire community. So in such cases, so how to manage the food nutrition? For example, protein, energy, malnutrition may be resulted. So in the infants. So whatever the intake and whatever the requirement. So if the requirement is there, to that extent, if the requirement is not going to be fulfilled, then that gap, food gap, that is going to affect the children, especially the children who are well below 5 years. So, and if they were to be poor and underprivileged community, so you just imagine to what extent we can see the health problems because of malnutrition. And post-traumatic stress disorder, depression, anxiety, all these things will be arising. Now, in general, if I can say very briefly, so there will be a lot of physical health, mental health, and physical injuries. All these things may be resulted due to the disasters. And some health problems are the respiratory and cardiovascular diseases, right? Cardio, if at all you are having, you assume that an individual is a heart patient having certain problems. So if he is not going to be taken care of, if he is not going to be immediately shifted to the place where he can get treatment, so how to manage for his survival? So then everybody wants to be in an hygienic environment. When the basic facilities, structures themselves are not available, how do you manage for a long term? How do you for maintaining a good healthy condition or a healthy environment? So there are many such type of problems that may be there. And look at here, after disaster has taken place, people or community will be moved into some old school buildings or some tents and some areas. How to manage the human excreta? Immediately, you cannot construct in an overnight the what fresh rooms, isn't it? So these are all the certain things that we are going to be there. And the occurrence of these flies, mosquitoes, rats, etc., may be on the rise. And by the time you start giving measures to say that immunization and other things has to be done for the individuals, right? So even that takes its own time, and everything immediately, as soon as you give immediately, everything will not be recovered. Everything will not be triggered to develop resistance against any disease. So, for example, the public health impact of floods, when flood is going to take place, look at it. Socio-economic impact will be there, effect on infrastructure will be there, environmental impact will be there. If you consider socio-economic impact, suppose I'm giving you an example here through this chart, what would be the health impact of floods? So, loss of livelihoods will be there when assets are going to be reduced. So, shelter will not be there, displacement of the people or the community will be there, and erosion of all your community structures will be there. So what will happen with such socio-economic impact? There will see epidemic outbreaks. Then we can see that there will be acute respiratory infections may be there. Malnutrition may be there. So psychosocial or mental disorders may be resulted. So likewise, various diseases, even it starts spreading, it leads to ultimately a high rate of mortality. And if the flood is going to have an effect on the infrastructure, see, if the health care infrastructure, if those are going to be destroyed, if the electricity, water supply, latrines, everything is going to be destroyed, destruction of roads are going to be there, then it leads to the reduced access to health care, right? Child mortality may be high. There may be even electric shocks. So once again, it leads to a greater mortality. And if you look at the environmental impact, you can see destruction of sanitation facilities, lack of clean water, increased parasites. So when these things are there, automatically cholera, malaria, typhoid, diarrhea, all this, including increased snake bites. So, for example, when Kerala flooding has taken place, many people were bitten by snakes because snakes started being carried along with the water, and with whomever they come across, sometimes they have bitten the individuals. So such things also will happen? This is the impact of environment. So that's, for example, flood. So if flood is going to be there, so if it is going to affect socio-economic and other environmental impact, so what are all the health hazards that one can possibly see among the community? Suppose likewise there were to be a drought. Assume that there is a drought. So if drought is there, water shortage will be there. If water shortage will be there, so what are the diseases? Chances will be there: cholera, skin diseases, eye diseases, typhoid. All these things will be there. And when you cannot cope up with, so it may lead to what? Morbidity and mortality. So similarly, excuse me, 1 minute. Right. Similarly, whenever there is drought, so crop failure will take place. There may be loss of livestock. So when all these things take place, automatically the demand for food, the demand for milk, the demand for everything will be rising. When it is there, if you are economically sound, you can afford to. But many people cannot be able to afford to purchase these things and use it. So there will be a reduced food intake. Suppose the price of onion. So price of onion is going to be reduced. Okay. So what will happen? Everybody is ready to use it. Suppose it is on a high scale, say 200 rupees per kg of rice. 200 kg of, if the price of the onion is for 200 rupees per kg, so many people will sacrifice onion. They don't want to eat onion. So just imagine, without onion, even if you want to survive, but there are many minimal nutrients, carbohydrates, proteins, rich compounds, grains and pulses we require for our survival. If the cost of these things go very high, and if there will be productivity of these is going to be decreased because of drought, then what will happen? So competition for survival will start. And competition for survival will last, the stronger individuals who are having right economic economic strength, so to say, they can afford to. But a very poor fellow may not be able to afford to purchase these things and use the food energy. So malnutrition may be resulted. So even child may not get sufficient nutrient food. So it may die. So there are many such type of health risks that is associated even when a drought is going to be resulted. So these things are not going to be exempted for even any medical professionals also. So even we know that doctors are usually treat individuals one-to-one specific disease or any injury, all these things. And suppose the number of doctors is very less and the health caring individuals are less, right? And if the available machineries are very less, say all of a sudden if there is only one X-ray machine, if 100 people rush in and everybody wants to have themselves first for getting their health being checked up. So look at this. These are all the problems that is going to be arising because of the disaster. Of course, healthcare is important to each and every individual, right? So it is vital for all of us some of the time, but the time. So that means we should think of the community as a whole to see that everyone should thrive and strive very happily and healthily. And of course, the general impact of disasters on health systems are many. So I cannot go into all the details because these are all the things just I am giving you as a what we can say a telegraphic information line, because each and every point takes lot of time to be explained. So health workforce may be affected with illness, disability due to hospital acquired infections, injuries, violence. So we may say that, say for example, the best one would be corona. So whenever corona, we think that, oh, it is the duty of the doctors and nurses to look into the individual and see that it should be cured. Even that also may get infected, isn't it? So even how many doctors and nurses or Medicare staff members have also lost their lives during such type of work. But it is inevitable that they do work. They do work. So such type of things will be there. And sometimes due to illness, a psychological trauma will be developed among the individuals. Sometimes rather than because of the what we can say, a particular disease or something else like that, thinking that, oh, if I get that disease, I may not survive, I may not survive that, like that, because of the psychological trauma itself, the individual may die. So such type of health hazards also we are going to see during the disaster. Okay. So, and sometimes the products, vaccines, medicines, so if they are in good amount, it might have been supplied. But if there is a shortage of these things, then how to cope up with the what? Such type of shortages to the demanding people for their health things. This is not required. 1 minute. Now, you know that to take care of the public health, right? Public health is more important all the time rather than the individual's health. So that means we should not only work for our own health, but we should also work for the entire community health when we are in a community. So, and to see that whatever the care that you are going to take for the entire community will automatically will be helpful to you also to survive in that community. And it is not one man's individual. It is the duty of the hospitals, schools, civic groups, nursing homes, elected officials, politicians, right? So all of them should work in an integrated manner, in a network of all these things. All the individuals should work day and night, everything to meet the health hazards that may take place due to disaster. So otherwise, the public health that is going to be there. What are the responses? Right, ongoing public health emergency response is the environmental hazard identification. First, you should identify what type of hazard that has taken place. Then, to mitigate this hazard, so you should have consultation, especially the health hazard consultations. So, what are the services that are available to meet these things, health hazards, and what is the need of medical assessment, and what type of need is there, right? And how many individuals are affected, and who are all the type of individuals that are going to be affected. So that is identification of affected individuals also must be there. Then the overall health surveillance, everything should be there, and laboratory specimen collection and analysis that should be carried out. So likewise, here I am showing you, I am displaying you, all these are all the public health emergency responses in any disastrous area, any area where disaster has taken place. Okay, then disaster response organizations play a crucial role when disasters happen anyway. So there are many organizations that collaborate and partner effectively to provide assistance. So now, for example, CARE is one such uh, organization, right, which is fighting the global poverty. So it is going to be helpful in supporting the survivors of war, natural disasters, and rebuild their lives. So there is one more organization called International Medical Corps. So they too also work for the people who are going to be affected in any natural disasters. So that means there are organizations who are really working for what? Working for the health of the individuals or the welfare of the individuals who are going to be affected with disasters, especially even the what? Health hazards. Okay. International Rescue Committee is another organization, right? purely based on humanitarian crisis, it is going to be working, and it is going to help the people to survive and rebuild their lives, including taking care of and curing of their various diseases. Then Medicine Sans Frontiers, right? Doctors without borders, right? That means they are the doctors who do not confine to one particular place or a country. So they are available anywhere. They can go anywhere in the world, and they want to attend to the patients and deliver the immediate medical aid to the people for any of the conflicts or epidemics or any sort of the health problems. So that is there. Then Save the Children is another independent organization which is concentrating only how to rescue the children during disasters or after disasters, and how to see that these children should be taken care of from the health and make them to get into their families. So that is another organization which is working. Then United Nations Health that is Higher Commissioner for Refugees, that is UNHCR is also there. Of course, they take care at international level to safeguard the interest, the protection of the life of the refugees worldwide, anywhere, UNHCR, right? The World Food Program. The World Food Program is the world's largest humanitarian agency which is fighting worldwide the hunger of the people, especially after disaster. So they start immediately to transport whatever the food that is required for the people who are hungry and fasting due to the disaster or the place where disasters have taken place. So basic items ultimately to have in case of disaster of emergency is individually, if I can say, right? You should have always with you as a what we can say precautionary measure if at all the area is prone for any sort of disaster. You must have at least a minimum of 4 liters of water per person, right? So at least by the time the concerned authorities will come and reach you, at least it may take, assuming that it may take about 3 days. So at least you must have 4 liters of drinking water per person. And you must have a non-perishable food item. One should have a non-perishable food item, which is, and it should be, even if you are having any food things or something else like that, it should be immediately prepared or consumed. Okay. Then you should have something, a light, torch or something, any means by which you can, a solar lamp or a solar light or anything you should have. Then a battery powered or a hand cracked radio. And these are all the things that is minimum required. Nowadays, whenever disaster takes place, communication will be lost at many places. So that is why basic items you should have during an emergency is a first aid kit, which can give you the minimal materials for say, for example, for a normal basic fever or any injuries. So, or for headache. So, for something like that, you should have minimum what we can say a first aid kit should be there. And you should have the location, a map of the location of your area. Yeah? And the emergency services wherever it is available for the nearest place of your what we can say inhabitation. So that should be known to you. So what should be the route? So where exactly you are locating all these information, you should communicate it to the authorities who would like to come and rescue you during such type of disasters. So likewise, you should have so all these basic items with you whenever your areas are prone for disaster. And personal documentation, documents must be there. Sometimes it so happens that, see, all of a sudden, if there is a flooding, if a house is going to be drowned, people are drowned, and house is going to be submerged or devoured. So something happens, destroyed or something else like that. You don't have a records. A person cannot speak, and if he is ill, so how to get about his health status, and where is he from, where he was going, at least some address or something else like that. So any of the things related to personal documents should be always kept with the individual. So one should keep these things. So cell phone with chargers, right? It so happens. These are all simple things. So in such cases, the technology will come to be of greater help. So these things we should look in. So family and emergency contact information, a list of phone numbers or addresses, you can maintain a book or something else like that. And sometimes for emergency, so you should have some money, and also the blanket or something else like that you must have. So there is a disaster management policy. So this disaster management policy is the one which is aimed at using administrative decisions, organization skills, capacities, etc. Ultimately, to see that the society or the community should come with the lesser effect or lesser impact of natural hazards or any such sort of disasters. So even the modified act of these policies, that is Disaster Management Act of 2005, is now also modified with certain rules and policies. So this is mainly aimed at, what we can say is that, covering the institutions, the legal and financial arrangements, disaster prevention, mitigation and preparedness, techno-legal regime. So all these things, rehabilitation, reconstruction, knowledge management, research and development, all these are going to be what? Are being mentioned in detail in this, what we can say, the policies and rules on Disaster Management Act 2009. The principles of disaster management policy, mainly, if I can pinpoint out, is you should prevent the disaster. Right. Suppose there were to be an epidemic of any health hazard, how to prevent that disaster? So that is to be understood and that has to be implemented. Then minimize the casualties. This is the basic principle of this policy, disaster management policy. So casualties, you should not allow the people to die, right? So how many, to the best of your ability, how many individuals you can make them to survive? So minimize the casualties. And how to prevent further casualties. That is the principle. So if what we can say, disaster has taken place at one place, so how to see that? So sometimes even it may be a fire disaster. If fire has been spreading, how to prevent this fire being spreading? Right. So that is what? Prevention, casualties, that should take place. Rescue the victims. So whether it is by air or by water or by land. So mode of this transport and rescue the victims should be the prime principle of disaster management policy. Of course, giving aids, primary aids or preliminary aids, to the people who are going to be affected and evacuate them to the respective safer places, and attending to their, what we can say, the health and other related issues. And ultimately, last but not least, is about the reconstruction of their, what we can say, reconstruction, rehabilitation, of their social living, cultural living, economic living. So all these things will be included. So if these things are there, you can definitely think of managing the disaster, if not to an absolute extent, at least to a greater extent. To a greater extent. So this is a topic which we cannot make it very interesting in the sense, to see that, when a disaster is going to take place, so what are the answers, how to manage it, all these things. Though we may try to go theoretically, speak on, share and all these things, practically if you are in the field, practically if you go there, you can understand whatever that I have now shown you. So even these points appears to be nothing like, because especially the mental health or the mental well-being is of prime importance for any individual to be happy in any area, whether it is in a disaster prone area or a disaster area or in an area where you are living now. So if you want to be happy, what you will do? So you want to have all comforts. You want to have all comforts. If you want to have all comforts, that means there should be no intervention by any means, physical means, right, or physiologically or mentally, right. No one should disturb you. Even if you are having all the assets required for your leading a better life, but if somebody is going to what always irritates you, right, and if you are not going to be strong enough mentally to cope up with, so then you will become a mentally weak individual. So that is what. So sometimes, so whenever people are there in crowds, or such events occur, they may develop schizophrenia. So sometimes, even without that, also they may develop schizophrenia. The reason is because you have got something, you will not be happy with whatever that you are having. You keep on aspiring for more and more, more and more, more and more. And when nothing is going to be to your satisfaction, you always think mentally, you always worry mentally, right? So, mental health is very important. So, know your limitations, know your requirements. So, whatever that is required for your today, only aspire for that much. So, the moment you are now living, the moment now you are hearing, so only whatever that is required for that you think of, right? The very next moment, right? Whether you are there or not, we do not know. So then, when you do not know your next moment itself, why do you want to be greedy too much for the assets of nature? So ultimately, you have to keep your resources intact and keep your resources always in reserve. Keep your resources always in reserve. Reserve means not in your backyard. Keep them in your natural habitats. So whenever any such disasters take place, at least these reserves from one area to another area to meet the requirement of the affected people can be transported, can be supplied, can be shared. So only in such cases the health hazards can be prevented. Otherwise, suppose one disease occurs, if it is a communicable disease at one area of a disaster hit area, then it may spread to the other area and may take the entire population. So we should not be under the impression that today the fire is in the neighbor's house. Anyway, my house is very safe like that. You should not simply keep quiet. You should have a vision that if a fire is broken out in the neighbor's house, how to mitigate it, and suppose it spreads and all of a sudden comes, how we should be prepared to meet that challenges, meet that what incidents, right? To rescue ourselves, to be on the safer side. So likewise, we should have the principle and we should follow the principle that each and every individual has got the right to live, including animals. So even animals are also going to be greatly affected with various such type of diseases. The only thing is that we are concentrating on humans because we want to always protect the human life to the greatest extent or to the core rather than the animal life. But whenever disaster have taken place, they have taken the life of many animals also. Of course, plants quite but natural. If they get submerged, so either they may survive or they may not survive. So if they perish, ultimately it is a natural loss in the nature. So with these few, what we can say points, I don't know how best I could be able to tell you about the impact, the health related aspects during disaster. I didn't want to take any specific disease or anything else like that because it is not any disaster and any disease is not specific. So there are many diseases during each type of disaster. So it may keep on varying. So whatever the health hazard that is going to take place in one area may not be the same in another area. But ultimately, what I can say is that air pollution, water pollution, right? So the surrounding pollution should not take place. The reason is because for meeting the basic requirements of food, shelter, and a good health, we should not allow the disease causing microorganisms like bacteria or viruses to get multiplied or increase in their number to affect other individuals. We should not encourage the growth of the disease carrying vectors like mosquitoes. Okay. And above all, we should have the feeling of oneness to care, to share and care for the fellow individuals, right? For everything, whether it is food or whether it is little money or whether it is for shelter or something else. So whatever the help that is possible on our part, we should lend our, what we can say, lend our mindset, right, in every possible way, to support them socially, economically, culturally, and environmentally. So with these few words, once again, I thank you for all your patience, especially after the lunch, to listen to a drier topic. Thank you, one and all. If you have got anything, you please ask me any questions. Hello. Hello.
Excuse me, sir. Good afternoon.
Yes.
Sir, are you audible?
Yes, audible. Tell me.
So I have one questions from my side. So health and disorders management is a very important concept of common life people also. As of that, health is based
Sir,
on.
1 minute. Sir, 1 minute. A bit loudly you speak. Here
Okay,
some
sir.
audio quality is coming too slow. Tell me, sir.
So disaster and health, it is included health education. Okay. So what are the strategies are very important to educate the people in disaster duration of the pandemic? It is better way for communication. What are the strategies are better strategies is there for communicate
better strategies for educating
health educating the
people. Now there are two things I will tell you. One thing is that normally you should identify the areas which are prone for disaster. There in that area, the community, for example, if that area is prone for flooding, so the people in that area should be educated as to how to manage with the floods. What are the sources and chances of this flooding take place, and how the flooding is going to affect the life of the individuals in that area. Like that way you can plan and strategize the education programs that is in that particular area. The other way is that even though the disaster may take place anywhere, but in general, for mitigating the disaster, say for example, for a flood, for an earthquake, so whenever the health, how to rescue the people and how to see that the anxieties, mental stress, and health hazards should be prevented. How to help them to give them the basic, what we can say, the health needs, how to inculcate the, what we can say, the courage or strength, inner strength for them to resist themselves from all possible, what we can say, mental agony and other things. So likewise, anywhere if you can educate the people, and if that team elsewhere can also go and what, reach the any area where disaster has taken place. So there they can think of. To do this one, what happens is that, so there are two things. One is a common way of having education, a formal education system like, and if the people cannot understand, audio visual means or methods by which we can mitigate these disasters. So you can show them some pictures, you can show some the past events and incidents. So based on that, how to see that when such incidents have taken place immediately, say for example, if flooding is there, how to take care of a country boat, how to say shift the people, how to have ropes and what? Carry the people from one area to another area. If there is a medical emergencies, how to shift them from one place to another place to attend to their medical needs. So likewise, there are what we can say for technical orientation of education is different, and a typical formal and basic education is different. So both the ways, if you prepare the individuals in any area, I think that will be the best strategy to manage with the disaster. And one thing is that real experts should be prepared. Expertise means it should not be theoretical. Suppose you ask me, yes, I know that people, if they are going to flooding, they should be saved. So I should be a good swimmer. I should know what are the, like that if I know. So if I don't know swimming and if I simply get a theoretical education, what is the use? I might have read theoretically many things about medical aspects, but at the same time, practically, when an individual is going to have an injury or a wound or a cut or any of the respiratory problems, what is the preliminary or primary aid that I can support the individual, right? So that is what one should do. So that type of education should be given to the people, right, in a plain and common language with common techniques, with the locally available techniques also. So we can think of managing any health hazards or any sort of what we can say disaster, so to say. That is what my feeling with respect to education. Education does not necessarily mean that only through a textbook or through a literature we can read and we can what? Implement it. Whatever that we read, when we go to the field practically for implementation, there will be a lot of variation. There will be a lot of variation. So that is where the experiences also will count. A diver may not be having an experience as to how many individuals theoretically I should go and respire and lift up. No. So he may be anything, but if he is a good diver, he can swim and he can rescue many individuals. So practical oriented knowledge, experience oriented or experienced individuals, right, should be involved in training the youngsters, in training the people, because why I say youngsters, they'll be more energetic. So they can absorb, they can grasp, they can catch hold of, right? And they can definitely build the nation, they can protect the community as a whole. So such type of education is required. So education in the sense, it should not be in one word or in a few one sentence, should not be like a bookworm for a purpose of scoring and keeping that I have done master degree in disaster management. No, that is not at all required. That is required for you to think what best and how best I can use all this knowledge to put myself practically in the field and help the people. So that type of education is required. Is it okay for you?
Yes, sir. Sure. So actually, you are facing that kind of problems in COVID-19 pandemic. That time I'm working as a STC district coordinator. We are
actually COVID. No. I will tell you, COVID-19 pandemic, though it has taken place, so we could have educated. So of course, they said mask hakali, you sanitize yourself, keep a distance, all these things will be there. But at the same time, there is nothing to worry about and nothing to be panic about COVID. And you should say, eat well, your nutritious food and all these things, you should well maintain the distance. So these minimum things and education, though you have educated, there are people who are adamant to say that nothing will come to me. No virus can attack me. Like that, they were behaving like that. So that is what education means. So what would be the impact? What would be the danger? Until and unless it is going to affect your own kith and kin, right? You will not experience like that. You should not have the attitude. Whoever might have been affected, but how best I should take care of myself, my community, my surroundings. That is most important. So it is not only you should keep your environment clean, you should keep your other people also to see that if you do not keep your environment clean, what will happen? Suppose a virus is going to multiply at one individual, that means the area is unhygienic. So if the area, if you do not keep the other, your environment like that, this type of disease may be carried to you also like that, one should say. Now that is how these communicable diseases like dengue or corona, all these things have been resulted. And sometimes I feel that even in India, the death rate of this corona is primarily because of, in some areas at least, some lack of this knowledge in the sense adamancy to know about it, and even if they know about it, they don't want to implement it, they don't want to care about it, they feel that they are very strong individuals, they are superpowers, nothing will happen like that. So such type of attitude will ultimately collapse the entire community. So that is where awareness, creation of awareness, public awareness is a greatest challenge in India about anything for that matter. Not only health hazards, even about your resources, even about protection of your resources or conservation of resources. That is the greatest challenge. Yes, please.